I'm here. Hello, Lillian.
Good. We are all set. May the chair online, the moderator online, please start the session. Thank you.
Thank you very much. Good afternoon, good morning, good evening, wherever you're joining us from. Welcome to the special session on diversity, tolerance, and equity at the heart of the HIV/AIDS response, holding at ICASA 2023. I do have the honor of being the chair of this session. My name is Oluwakemi Gbadamosi. I work with the AIDS Healthcare Foundation as the Director for Advocacy, Policy and Marketing for Africa. I'm also honored to have a co-chair who is also a sister, and that is Madam Lillian Moreko of ICWEA. And together we would be leading you with our seasoned speakers on this particular session. Now, we know that when it comes to the HIV/AIDS response, we've made a lot of progress over the years. For the past 40 years, we've made progress in terms of reducing new infection rates, access to treatment for many, as well as ensuring that we reduce AIDS mortality. However, the research and studies and data show us that there's still a long way to go. For example, we're still recording over 1 million new infections. Even when we look at young women and girls, HIV infection rates, even in sub-Saharan Africa, is very high. We also realize that a lot of people are still being left behind. Stigma and discrimination continues to pose a challenge, as well as unfavorable policies that actually do not take into account diversity, neither does it take into account inclusion. At the same time, when we look at policy and practice, we see a strong intersection between HIV and gender. This points to the fact that we need to do things differently, ensuring that there is a strong integration between human rights, gender equity, inclusion, as well as diversity when we talk about advancing access to testing, to treatment care and support. Now, what does this mean in policy and practice when we say putting diversity, equity, tolerance at the heart of the HIV/AIDS response? Our patient care programming or policies driven by an understanding and appreciation of the diversity that exists, such as culture, gender, sexual orientation, or even religious beliefs? Are they responsive to the needs of the individuals and the context that they live in, regardless of who or where they are? Do our programs, our policies and practice recognize those that are falling behind or are hard to reach, and make the needed change, centering them in the heart of the response to see that we find them and bring them into care? Do they give individuals, particularly those affected, a voice and an opportunity to utilize that voice in delivering or contributing to the care and the treatment or support that is appropriate to them? These are some of the discussions we'll be having today, and we're lucky that we have very seasoned speakers who are experts in this field, and they will be touching on this topic, looking through the lens of gender, disability, as well as men engagement and men involvement. It is our hope that we can draw lessons from the speakers, from best practices, to improve our programming, as well as close the existing gaps so that we can achieve global AIDS control, as well as ending HIV as a public health threat. Ladies and gentlemen, participants in attendance, as well as our speakers, on this note, I'd like to hand over to my co-chair, Lillian Moreko, to introduce our speakers as we go into the session. Thank you very much.
Thank you very much, Madam Chair, and good afternoon, everybody. I would like to, first of all, ask if Honorable Irene is in the room to please come and join us. Okay. So allow me introduce our speakers that we have here with us. We have Dr. Elizabeth Kihika, who is an esteemed infectious disease specialist with over 16 years of experience, currently serving as a program manager and medical doctor at Alive Medical Services since 2008. With a focus on advocacy for HIV prevention, her impactful leadership has significantly contributed to the comprehensive provision of HIV and AIDS, sexual reproductive health and rights services to a substantial number of clients annually. Dr. Kihika's journey is not just one of medical expertise. Her commitment to improving the prevention, diagnosis, treatment, and retention in care of individuals living with HIV is evident through her active involvement in national and international committees, including the National HIV Prevention Committee under the Uganda AIDS Commission and Technical Working Group on Differentiated Service Delivery Models. Please join me to welcome Dr. Elizabeth Kihika.
Yes. Thank you very much, chairs. Good afternoon, everyone. All protocol observed. Given that I have been introduced, allow me recognize my directors who are here, directors of Alive Medical Services. I have Dr. Pasquin Ogunsaya. She's waving at me, and Dr. Adebi also waving at me from the back. That was a confidence wave. Thank you very much. Allow me to also express my gratitude to the ICASA organizers and Minister of Health and Child Care, Zimbabwe, who invited me to have this special session while I was actually celebrating my birthday. Thank you very much.
If the slides can be put up, please.
No, that's not my slide.
Slide should be reading Elizabeth Kihika.
Yes, as they sort out the slides, I'll be starting because I know the time is ticking. Yes, so I want to thank you all for joining us at the 22nd ICASA conference, which is a pivotal HIV conference where we convene not to only explore the latest in research and treatment, but to underscore the paramount importance of diversity, tolerance, and equity at the heart of the HIV and AIDS response. I think the slides are on their way. They'll catch up and find me where I would have reached. Thank you. So we'll ask ourselves, what is diversity, what is equity, and what is tolerance? We look at diversity, that's where we have different and multiple characteristics that make up an individual and collective identities that include race, gender, age, religion, sexual orientation, ethnicity, national origin, socio-economic status, language, and physical ability. When we look at equity, on the other hand, it is the process of identifying and removing barriers that create disparities in the access of resources and means, and the achievement of fair treatment and equal opportunities to thrive. And tolerance is the quality of allowing other people to say and do as they like, even if you do not agree or approve of it. So how important is diversity, tolerance, and equity in the fight against HIV/AIDS? When I was invited to give this special session, I opted to reflect on my real life experience and share. 16 years ago, when I started out straight from my internship, my days were often filled with the gravity of draining chests abdomen, tapping spines, performing biopsies as we sought answers to the mysteries of HIV. Each procedure was a reminder of the profound impact this virus had on individuals, families, and friends. Fast forward to today, I can share a different narrative. The landscape of HIV has transformed from a time when we grappled with the unknown to an era where we can confidently say that with proper treatment, individuals living with HIV can lead a healthy and fulfilling lives. A year can now go by without the need to conduct the invasive procedures that were once in commonplace. Today, we can say kudos to Botswana, Eswatini, Rwanda, the United Republic of Tanzania, and Zimbabwe having achieved the 95-95-95 targets by 2022. However, as we celebrate the triumphs, we must not forget but confront the harsh realities that hinder our progress. Africa is a continent where the battle against HIV has been fought valiantly, yet challenges persist. I recall one of the session speakers earlier in the days that said, "Fight HIV based on science and data." The statistics tell a story that demands our urgent attention. It is estimated that over 2/3 of all the HIV people living with HIV worldwide reside in sub-Saharan Africa. The UNAIDS report revealed that 53% of all the 39 million people living with HIV were women and girls. Women and girls accounted for 46% of the 1.3 million new infections in the year 2022. Young women and adolescent girls aged 15 to 24 face a higher risk of contracting HIV, that is about 3 times, they are 3 times susceptible to HIV compared to their male counterparts in the same age range. The same report also revealed that 70% of the new HIV infections in 2021 were among the key populations and their sexual partners. These figures are not just numbers. They represent lives, dreams, and untapped potential. When we speak of diversity, tolerance, and equity, we must acknowledge that HIV does not discriminate. It affects individuals irrespective of their race, age, gender, economic background, or sexual orientation. In Africa, the burden of HIV is exacerbated by discriminatory legislation, stigma, societal prejudice, human rights violations, and stereotypes. To truly understand the impact of these, let me share a real-life story from my practice. It's unfortunate the slides are yet to come up, but we'll channel on. I'll share a story of Alexa, who is a 28-year-old transgender woman with a dream of being a world-renowned makeup artist and a hairdresser. She has been living with HIV for the past 5 years. Alexa was rejected by her family at 17 years and has always relied on herself and friends. But COVID-19 caused her to lose her job as a hairdresser, forcing her to join a shelter for support. As life was beginning to stabilize, she had to leave the shelter and her medicine behind, running for her life when the neighboring community came up in arms to evict them because they suspected them to be homosexuals. Thankfully, she easily got a refill from her facility. She moved in with a friend, but 5 days later, she had to be admitted to treat wounds, having been assaulted by a mob organized by the friend who had seen her ART teen. She couldn't report to police for fear of the threats from the friend who was ready to disclose her being a transgender to the police. The horror stories Alexa had heard from her friends who had experienced arrests and inhumane exams forced her to keep her silence and move away. She had to survive on sex work for some weeks, sleeping on the street, before she luckily got another shelter. Alexa today prefers to pick her refill in the night under the cover of darkness. But Alexa's narrative is not unique. Across this continent, countless individuals face similar intersectional challenges, where dreams and aspirations are overshadowed by the weight of societal judgment and discriminatory legislation that casts a shadow on our progress against the fight against HIV. The consequences of stigma are profound and far-reaching. Our duty is not to just champion medical advancement, but to challenge societal norms that marginalize and ostracize certain groups. The fight against HIV necessitates a unified front that transcends prejudices, fostering an environment of care, acceptance, and understanding. I'll share another story of a 19-year-old Eliana, a girl who is an orphan from Namongo, a slum that is one of the neighboring slums in Kampala. She contracted HIV through mother-to-child transmission and faced insurmountable hardships, prejudice, and isolation during her journey. However, Eliana refused to be defined by her condition. She empowered herself through education, obtaining accurate information about her health, and transmitting that knowledge to others as a peer educator. Eliana went on to start a support group in her community, bringing hope to countless others who felt marginalized. Eliana's story is a testament to the transformative power of equity in HIV. Equity means ensuring that all individuals have equal access to HIV prevention, treatment, care, and support services, irrespective of their circumstances. It recognizes the unique needs and challenges faced by the key populations such as sex workers, men who have sex with men, transgender individuals, people with disability, people who use drugs, etc. The stories we have had are not isolated incidents. They represent a broader narrative of resilience and courage in the face of adversity. As we listen to these personal accounts, let them serve as a call to action. We must confront the discriminatory laws, like the anti-homosexuality law in Uganda, and societal attitudes that amplify challenges faced by individuals living with HIV. A friend once asked me, "You have worked at Alive Medical Services for some time now. What is special there?" My reply was simple: the unwavering commitment to the vision, mission, and core values practiced there. Alive Medical Services is not just a workplace, it is a beacon of compassion and transformative care. In a world where healthcare is often a privilege, Alive Medical Services envisions a world in which all those in need of medical care have access to state-of-the-art medical services provided with love and dignity. This has only been possible because of the support we've received from Ministry of Health, Uganda AIDS Commission, our different donors, including PEPFAR CDC, the Elton John AIDS Foundation, UPMB, Global Fund, Frontline AIDS, Bill and Belinda Gates, IDI, among others. This has made it possible for Alive to keep its doors open 24 hours, 7 days a week, providing free, high-quality treatment to all, even those who need post-exposure prophylaxis at 2 a.m. It is not merely about medical services. It is about creating an environment where everyone is served with love and dignity, regardless of background, circumstance, or lifestyle. It is abundantly clear that our path to an HIV-free generation is intricately tied to the principles of diversity, tolerance, and equity. As we stand at the forefront of this global health challenge, we must recognize the collective responsibility we bear to amplify the voices of those who have faced discrimination, to listen intently, and to learn from their experiences. Our mission extends beyond the clinical realm. It necessitates a commitment to addressing the social determinants that hinder our fight against HIV. Our mission extends beyond the clinical realm. It necessitates a commitment to addressing the social determinants that hinder our fight against HIV. Diversity, far from being a mere concept, emerges as a formidable strength to be celebrated. Our battle against this virus must be inclusive, understanding, and addressing the unique challenges faced by diverse communities, be they cultural, socio-economic, or related to healthcare access. Next slide, please. Tolerance as the cornerstone of our response calls us to cultivate an environment where individuals from all walks of life feel accepted and supported. Eradicating stigma is not merely a goal, it is a necessity, like removing restrictive laws, given that criminalization fuels stigma and stigma fuels criminalization. This will deter individuals from seeking testing, treatment, and support, perpetuating the cycle of transmission. Stigma will not be eradicated without the removal of criminalization. Let us therefore collectively commit ourselves to creating a world of acceptance where open dialogue replaces discrimination. Equity in healthcare stands as a paramount principle and is non-negotiable. Access to HIV prevention, treatment, and care is a universal right, irrespective of one's background. Discriminatory laws deepen divides, making it essential for us to champion policies promoting equal access to HIV prevention, treatment, and support services for all. By doing so, we not only align ourselves with the principles of justice, but also enhance the efficacy of our strategies in curbing the HIV epidemic. Let us pledge to dismantle systemic barriers hindering equal access to information and services, ensuring that no one is left behind in our fight against HIV. Next, please. In conclusion, next slide. In conclusion, as we navigate the complexities of this global health challenge, let our commitment to diversity, tolerance, and equity guide our actions. Together, we can build a future where HIV is not just a medical concern, but a beacon for unity, understanding, and shared humanity. In the face of discriminatory legislation, let us be the advocates for change, engaging in open conversations that challenge stereotypes and dispel myths surrounding HIV. It is our shared dedication to these principles that will propel us towards the realization of an AIDS-free generation, a generation shaped by compassion, inclusivity, and a steadfast belief in the universal right to health for all. Thank you for your unwavering dedication to the cause. Thank you.
Thank you so much, Dr. Elizabeth. In the interest of time, I would like now to introduce our next speaker, Innocent Modisaotsile, and apologies, I'll ask you to pronounce that name, who is the Sexual Reproductive Health HIV Advisor for UNFPA Regional Office for East and Southern Africa. He has over 3 decades work experience in public health, particularly in areas of HIV and AIDS and sexual and reproductive health at national and regional levels. He's credited for a number of achievements in regional policy harmonization and cooperation in health in the SADC region, where he has spent 13 years with its secretariat. He has extensive work experience with the United Nations systems, having worked for UNDP and UNICEF. Join me in welcoming him.
Thank you very much, Madam Moderator. Fortunately, I'm lucky enough that as I start, my slides are on. I don't know how they've survived. Unlike my sister, I didn't have plan B. I completely relied on the slides. I have been asked to share some reflections on the issues of male involvement to end AIDS in our continent. And I've decided to premise my discussion on 3 issues. First, I would want to discuss a little bit why it is important to engage men. Secondly, I will try to discuss models that we can use to actually engage men. And thirdly, I'll share some of the promising practices in the continent of engaging men. Next slide. As it has been indicated, I work for UNFPA, which is basically a sexual and reproductive health agency. And our work is really anchored on 9 bundles of SRH services, one of which is obviously HIV. And what we seek to do is really to actually try and promote positive masculinity so that in our work as we deliver, there could be actually be the necessary respect for women in terms of delivering the SRH services. Next slide. The big question is why is it important for us to engage men in our journey to end AIDS in the continent? As we are all aware, the face of new infections in Africa is women, but the face of mortality of AIDS-related disease are men. Basically, there are fewer men who get the infection, but in terms of proportion, there are more men dying of AIDS-related. That actually summarizes the challenge that we have when it comes to the epidemic. So why do we need to engage them? First, we need to engage them as agents of change. We do believe that they have an important role to play to influence others to actually address the issue of HIV. We know, for instance, that in many countries, men are actually the bridge to the transmission of HIV. For instance, studies that have been done in some countries on men who buy sex have actually noted that through that process, the transmission of HIV is actually multiplied to other women who are not who are partners of those men who buy sex. The second reason why it is important to engage men, when in almost all of our countries, when you look at policymakers, the majority are actually men. So it's quite important that men must actually be engaged so that we can achieve the necessary change that we want. For instance, if you look at general leadership, including traditional leaders, you find that it's predominantly those seats are occupied mainly by men. So for us to make a headway in terms of addressing HIV, it means men have to be involved. It is also important to note that men are also clients and seekers of HIV services and SRH services in general. So it is important that we address them and we involve them because their needs may be different to those of women. But also importantly, men as partners, it's very important that we engage them because we would want their engagement with their opposite partners to be that of respect. And that's the only way in which we can actually achieve ending AIDS. When you are discussing sensitive issues such as transmission of mother-to-child transmission, the involvement of men is important because more often than not, the blame game starts. And if the man is not involved, it's quite easy that they will actually blame the other party for that. But as we move on as a continent, it's also important that we consider men also as caregivers. I don't think we can continue as a continent to relegate the issue of caregiving to just women. So men need also to play an important role there, and that's why we need to engage them. So basically, that's the reason why it is quite important. And I want to move to the next slide, which then tries to look into what are the effective pathways to engaging men. And here we have actually adopted the social ecological model to sort of propose the most effective ways in which we can engage men, which includes basically looking at the individual. And here we propose, and as UNFPA, we have invested a lot in terms of comprehensive sexuality education so that we can actually engage young boys in and out of school so that they could actually understand their vulnerability, and also to try and promote positive attitude and positive norms among men. But it's also important that another pathway that we could use, obviously, is around community organization and also institutional levels. We have been talking about community leading. We also have community of men. So we need to find opportunities in which we can use those opportunities to actually give them appropriate information so that they could influence each other positively to actually address HIV. Another level that needs to be addressed is also the policy level, where we need to advocate for the development of appropriate policies that actually reflect on issues of male involvement, including reflecting on issues on such of things such as GBV, which we know they have a correlation with HIV infections. Next slide. Now I want to move on to some of the examples to just indicate that in many of our countries, there are many positive examples of male involvement. We have examples from Uganda, from Kenya, from Niger, and from Malawi, where there are examples of efforts to actually promote male engagement. Next slide. And when you look at the example from Uganda, there are a number of efforts and a number of achievements, although they are at small scale, that have actually contributed to male engagement. And I think it's really upon us to sort of amplify those cases so that more countries and many sectors can actually put in place systems for male engagement. The next example, next slide. The next example is in Nigeria, where there is actually an attempt to actually have schools for husbands, to actually educate them on issues that are related to GBV and to HIV and SRH in general. Next slide. There are also examples, like I indicated, in Malawi. And an example of Malawi is actually the policy. As you can see there, that they have had clear policies that are around male engagement. Those are some of the examples that they have. And the next slide also shows examples of engaging community leaders and also engaging a group of men, societies of men, as opportunities for male engagement. Let's move to the last slide, which is really my conclusion. So in my conclusion, I want to indicate that ending AIDS will require the involvement of all persons. And one of those persons or people are actually men. We believe strongly that men have a critical role to play because we know that, first of all, they have special needs in as far as HIV and SRH is concerned. But we also know that they are drivers of negative outcomes of HIV and SRH. So involving them actually helps. To give you an example, part of the reason why HIV continues to be a reality, new infections, is because a number of men are actually not viral suppressed. And a man who is not viral suppressed, it means it's easy for them to pass the virus to their partners. So if men were actually all viral suppressed, it means there will be less chances of actually passing that virus to their partners. So them being involved and them also taking active engagement doesn't only help them, but it also helps women in the process. So we do need to recognize that there are some promising practices, but they're at a small scale. And if we really want to end AIDS by 2030, there will be a need to make sure that we scale up those promising practices and make it part of our lives to actually engage men so that they're part of the response. I thank you for listening.
Thank you very much, Innocent. I don't know if our chair is still online.
Yes, I'm still here, co-chair. I'm still here.
Please take it up from there.
Thank you.
We have about a few minutes to close the session.
Yes, please. Thank you very much, Lillian, and also to our speakers as well. A lot of insights that have been drawn. Quickly, we want to see if we have any members of the audience who would like to ask a question. And just because of time, we would only allow 3 questions. So we ask that you please keep your questions very brief and succinct and straight to the point. Only 3 questions for our speakers. Thank you.
Thank you very much to our presenters. This is kind of a question and a comment. So I am from Sisonke National Movement, which is a sex work-led movement in South Africa. So for our second presenter from UNFPA, I know that there was a comment about the relationship of HIV infections with male clients who acquire the services. I think something that we do need to be cognizant of is that sex workers right now under criminalization as well as gender power dynamics are not in a position to negotiate condom use. And a lot of the time what happens is that the clients will either abuse, beat up, violate sex workers because they don't want to use condoms. And it's that behavior that is contributing to the spread of infections of HIV, especially among sex workers. And so this is why even in sex work programming, there has to be a focus on the clients. So how do we change the behaviors of clients so that they are able to engage in these services safely? Because as sex workers, we do believe in safe sex. It's part of our principle in the work that we do. However, because of these dynamics, it changes where we don't have the power to negotiate that. And so I think we do need to be very specific about the reason behind these HIV infections, especially within our communities.
Thank you very much.
Thank you so much. I think let's take on with that one because we are running out of time.
Yes,
Thank you for your understanding.
No, thank you very much for your comment. I think your comment underlines the importance of actually male involvement. It shouldn't really be a sex worker, a female sex worker trying to justify why we need to use a condom. Men should be empowered enough such that they are actually proactive in the use of condom. And also, they shouldn't see the solution of non-use of condom being gender-based violence, as we have noted in many cases. So that's why we are really encouraging programs that it won't be adequate just to focus on, let's say, sex workers in terms of programming. We also need to focus on clients. And beyond that, we need just to focus on general men as a whole. Because like we indicated, there are many things that they contribute to that negatively contributes to infections in our region. Thank you.
Thank you very much.
Chair, I think you can do the concluding.
Okay. Thank you very much, Lillian. Once again, I just want to say that we've had some very key best practices, insights, highlighting the gaps that we know already exist, but beyond that, also pointing us to some approaches that can help in changing the tide. And I just want to quickly emphasize, drawing from our speakers, on the need for holistic approaches that centers HIV within the full concept of development, and that's looking at a fusion of medical, social, and economic factors or determinants. Also, the need for policy, practice, or programming to be anchored on acceptance, understanding, love, dignity, support, and voice. We've also talked about shifting gender norms to ensure that we not only look at men as bystanders, but as people who are integral to change, integral as partners, integral as caregivers. Also looking at harnessing the power of communities, including men, and also responsive and favorable policies. These are some of the key points that have come out, looking holistically and comprehensively when we talk about HIV response. And that is within the context of diversity, tolerance, and equity, ensuring that no one is left behind, key populations and vulnerable populations, young women and girls, men, and all populations are actually carried along to ensure that we can end AIDS by 2030. Thank you to our esteemed speakers, also to my co-chair, as well as everyone who has joined us today for this session. And we hope that you've taken away with you something that you can use to also improve or expand the work that you do around ensuring that we have a more diverse, more tolerant, and more equitable HIV/AIDS response as we continue to journey along. Thank you very much.